Here we go. 3, 2, 1. Well, hello, everyone, and welcome to another healthcare discussion on the Heartland Daily podcast. My name is Anne Marie Schieber. I'm the managing editor of Healthcare News, and I'm joined once again by Devin Herrick. Devin is a healthcare economist and writes for the Goodman Institute Healthcare blog. Good to see you again, Devin.
Good to see you, Anne Marie.
We've got a lot to cover today. We haven't been around in a couple of weeks, and a lot's happened, especially with President Trump's great healthcare plan. I'm surprised he didn't put the word American in it, but it's not there. We're going to talk about what it is. It's all of 2 pages. And will it bring the changes in healthcare that Americans are so desperately craving? We're also going to talk about Senator Rand Paul's bill to remove liability protections for vaccine makers. And Elon Musk has released Medicaid data, database with all the Medicaid claims. And no patient claim names are going to be in this database. It's just an effort to crowdsource Medicaid fraud investigations. I think it's a great idea. That'll be real interesting. All right, let's get right to it. Let's talk about the great healthcare plan. And Andy, if you can kind of scroll through this, this has it's all of maybe 500 words. It's 2 pages, and it has basically a framework, very little on specifics, featuring 4 pillars. And those pillars are lowering drug prices. We got lowering drug prices, maximizing price transparency, lowering insurance premiums, and holding big insurance companies accountable, which is kind of like lowering insurance premiums. But anyway, we're going to talk about each one of these and what they mean. There hasn't been a whole lot of action on any of them, except maybe perhaps lowering drug prices. Republican Senator Bill Cassidy of Louisiana, a medical doctor, said that his committee has and will take action on the president's affordability agenda. So I assume he's talking about healthcare. He told the Associated Press that. And then Carolyn Leavitt, the White House press secretary, said every single American who has healthcare in the United States will see lower costs as a result. So this is the framework we are dealing with. It was sent as kind of a framework for Congress to work from. And these are the 4 areas they're going to focus on. So let's get to the number 1 thing, the item top on the list. I just want to mention one thing. Obamacare subsidies expired December 31st, and plan prices, premiums have skyrocketed to incredible levels, and there is a call to do something. But again, the subsidies are artificial reform. They don't solve the basic problems. All right, so let's go to the first one, which is lowering drug prices. And this is where we've seen some action. Trump has introduced Trump RX, and I think there are about 50 or so drugs on this. The prices, you have to pay cash for these prices. These are brand name drugs primarily. They're about 50% lower than you would pay out of pocket or through even a plan, and had a huge deductible to meet. The prices are based on what's called most favored nation drug pricing. Devin, what is your thinking on this? Is this a good idea?
Well, it's a start. It doesn't do anything, of course, to help people with help with a drug plan. And as you mentioned, if you have a high deductible, and deductibles have been rising over the last 20 years. I think my last deductible was $9,500. You're essentially paying all of your drug costs out of pocket. So, it's not a bad idea, but it's not a comprehensive idea. To have a website, and of course, part of what Trump is doing is strong arming drug companies to, make this, to make this concession for cash paying patients. And it'll put a little bit of pressure on drug companies to maybe extend some of these deals to, health plans. but it's only 50 drugs. I mean, how many drugs are there out there? I mean, obviously tens of thousands. Of course, the ones we use are probably on the much smaller number. But yeah, it's a start, but it's by no means, all encompassing and a comprehensive method to lower drug prices.
Yeah. And this is if you use brand name drugs. Many people use generic drugs, and it's not going to mean anything to you unless you have to use one of these expensive drugs. The most notable one, of course, is Ozempic and some of the obesity related drugs that cost several $1,000s a month and now are down to $500. But I mean, goodness, before all of this happened, I think it was Costco was the first out of the gate to introduce that drug for a cash price, $500. But here's the thing. Up until now, health insurance premiums, if you were in a drug plan, they would cover the costs of these drugs. You would meet your deductible. And if you're buying an expensive drug every month, you could meet that deductible very easily. Now, the health plans have no need to cover any of these drugs. So I'm not sure how much it's going to save people if that's how they were paying for these expensive drugs. I mean, certainly $500, that's $6,000 a year. And people on these drugs sometimes have to be on them for many, many years. So it's still going to be kind of pricey. I want to talk about most favored nation drug pricing. Now, conservatives are all over the map on this. Actually, most of them are against this because they think it is nothing more than drug price controls. And it de-incentivizes research and development of cutting edge drugs. Drug companies don't want to spend millions and millions of dollars developing a drug when they know the government can come in and control the price. They need to make a profit. They're not nonprofits. What is happening is the U.S. has to subsidize the price of these drugs that are charged in other countries, usually countries that have socialized medical systems, and they are told, drug companies, that they can only sell their drug for a particular price. So what's been happening is the drug companies come back to the U.S. and they say, all right, we're going to need to charge American consumers this amount so we can be even. And I think this is part of Trump's thinking on, in terms of tariffs, using it as leverage. I think it could have a benefit to this extent. The drug companies are really going to put a lot of pressure on these countries, because if most favored nation drug pricing is codified by Congress, that means those drug companies cannot sell that drug for any more than another country is selling it for. So they're going to put the pressure on those foreign countries to up the price. And I don't know what's going to happen. They may just say, they're socialized medical systems. They could just say, hey, we're not going to offer it to our residents. So it'll be real interesting. It's in bottom line, it's just not real drug price reform. It's another Band-Aid approach to fix the dysfunctional market. What is your thinking, Devin?
Well, yeah, it's the most favored nation pricing. It's a very complex issue because the first dose of a medication may cost $1 billion, $2 billion, and the second dose may cost 50 cents to produce because of the huge barrier to entry for getting a new drug approved. And of course, that's what creates the opportunities for drug makers to, charge Americans high prices because, what the market will bear, while giving other countries a free ride or a very low price. Now, some poor countries, they really can't afford to pay much more than they're paying. But some countries like Canada and, France, Britain, they essentially free ride. They just say, they know that they can get it. It's called price discrimination. Drug makers can charge different prices in different markets. And the reason they can do that is because the U.S. protects their right to do that by making it illegal to re-import or to import a medication by anyone but the manufacturer. And so essentially that protects the right of drug makers. And I've long said that, we can debate whether that's necessary. But at the same time, if you say, hey, you can't sell a drug cheaply to Brazil, or you got to give us the same price, well, they just won't sell it to Brazil. They're not going to lower the
Yeah.
price to Brazil's price to Americans because, well, A, they'd go bankrupt probably, and and B, it's just more lucrative they have to have the American market, but they don't
What if
have to
the
price
American
gouge
market?
like they do.
Yeah. What if the American market is the only market left? What if these countries tell them to get lost and say, we're not selling this drug for the price that you demand? I don't know. Many conservatives are against this idea. I don't know, Andy, if we could pop up the Hill article. So here it is. More than 50 conservative leaders sign a letter. This letter claims that drug companies are working hard already to get fair drug prices abroad. I don't know about that. They're nervous about Trump deals. And, back in October, he did a deal on fertility drugs, which are very expensive. And he got them down to a, most favored nation price. And then he promised the drug companies a new benefit option. Now, this to me was very suspicious because it probably involves somehow getting things like that are very controversial, like IVF, into employer drug plans or health plans. And if he says, okay, if we're going to give companies a tax break on their health coverage, they have to include this particular item. I don't know. It's just all really kind of a slippery slope. The idea that the administration is negotiating to get lower prices, again, it could all dry up in 4 years or whenever we have another administration. It's not permanent reform. There are so many ways. If we want to get drug prices down, I think the best one might be get rid of efficacy testing at the FDA. That adds enormously to the cost of drugs. We restrict drugs on offering drugs for off-label prescribing. Efficacy testing is just really a clinical testing on a particular market. And once these drugs get into the market, we really don't know how they are going to act in a large population. And many times we find a multitude of uses for drugs, like hydroxychloroquine, for example, which has been around for decades. And now we use it for so many things. And, to me, safety is an absolute essential. We used to do only that. But now, I don't know when it changed, but now FDA requires drug companies to prove efficacy. To me, that is marketing. And if a drug company wants to prove that their drug works, let them go do their own clinical tests and market it. But we shouldn't demand that for every approval. What do you think?
Well, one thing we've talked in the past about maybe let employer plans, insurance companies, decline. I mean, we kind of do to a small degree, but not a large degree. Decline to cover a certain drug. Like, for example, this drug doesn't work very well. We're not going to pay for it. And so the insurance or the drug makers would then have an incentive to either A, lower the price, make it a better value, or B, show studies proving it is in fact as effective, as valuable as they say it is. Allow more negotiations. The problem we have now, I think, is that once a drug is approved, insurance companies, Medicare, Medicaid, they're all under immense pressure to cover drugs that may, and we can all agree that some drugs are better values than others. And, I think there needs to be a negotiation among payers and suppliers, drug makers, over how effective or how the value of some drugs. I don't want the government telling them, but I would like in my health plan to be able to say, that the price you're charging is just so outrageous that we're not going to offer it. And if our clients, our customers, our enrollees, they can always change plans if they really like that one drug. So
yeah, and it gets back to the idea: if we were all able to control a pot of money to spend as we see fit on healthcare, we would all be better off.
Yeah.
All right. Let's move on to the next item, which is maximizing price transparency. Now, we had a really good article by our journalism fellow from the College Fix, Daniel Nucio, called Trump, Congress, States Push Healthcare Price Transparency. I don't know, Andy, there we go. We had some real interesting viewpoints in this article. So, there's a lot of difference of opinion among free market reformers. And, the single payer people, they have one mindset. That's it. But there's a lot of debate among free market reformers, which is good. And this is one area where there is some disagreement, and price transparency is a great thing. I think we all agree on that. But again, we're working with a dysfunctional market. So how useful can it be? This article presented two viewpoints, one from Ilaria Santangelo from Patient Rights Advocate, which is a really good organization. They've pushed policies such as laws in the state of Ohio, for example, which prohibit providers, hospitals from collecting bills from bill collection if the hospital was not transparent about the price. Mm-hmm. So that's a good measure. Consumers, if they don't know what the price ahead of time is, they shouldn't have to pay for it. And that law has been out for about a year. And I think that's a good way to go. And that group does great work in that area at a state level. Then you have viewpoints such as Linda Gorman at the Independent Institute in Colorado. Now, Colorado has a similar law. But again, she mentions this as what we've mentioned in the past. These are Band-Aid approaches because the problem is hidden prices, surprise bills. That's what we're getting to. Most people don't give a rip about what the price is because somebody else is paying the bill. Who's going to go on and see what your health insurance company is going to pay for, like an MRI, for example? They don't care. As long as, many people, their number one goal is meeting their deductible, so everything else will be covered beyond a certain point. And you get a lot of waste in that kind of setup. What do you think?
In fact, today I was reading a Kaiser Family Foundation Health News article that I wrote about, that I blogged about, that'll appear tomorrow, I think. And what they found is that a lot of hospitals are not complying with the requirement that they post their prices. And consumers aren't really using those prices. Who's using those prices? Other health insurance companies, other hospitals. They're using that data to see, wait a minute, how come Hospital B, our competitor, is getting more than we are? Or it's a health insurer saying, wait, how come Blue Cross gets a better deal than we get? And that's not competition, obviously. That's just, using data to try to collect more money or pay less money. But what really needs to happen, nobody, as you talked about, no one has an incentive. The hospital does not have an incentive to make it easy to compare prices. Yeah. Health plans aren't helping. Patients have little incentive to compare prices. But I think we can all agree that if I can get a better deal on an MRI, and if I can do it pretty easily, and if I know how, I'll do it. I've long told the story about how when my wife had a CT scan ordered, she almost got it at a hospital. Well, that was outrageous. So I looked up the price, found it for $403 instead of $2,700 or more. But that's because I'm a health economist. I knew I could do that. She didn't know you could do that.
Yeah. So
it's really three things we need to make transparency work. Patients need to have a well outlined incentive. For example, reference pricing. The California Public Employees Retiree Healthcare System, or Retiree Health Plan, did a experiment, maybe 10 or 15 years ago. They noticed that, for example, for knee replacements or joint replacement, the prices of joint replacement could vary from, like $20,000 to $100,000. And so CalPERS demanded that, I think it was WellPoint Blue Cross, I forget which, or maybe no, Anthem Blue Cross, they demanded their health insurer conduct an experiment. And that was, they spent maybe a year telling doctors, telling hospitals, telling patient or enrollees, if you go to the wrong hospital, you're going to eat the difference. We'll give you a list of, I forget how many was on the list, but we'll give you a list of, I think it was like 50 hospitals that will do this surgery for 35, I think it was 30,000, 35,000. I forget the
Right.
exact number, but they essentially told them, here is the number we are willing to pay. Here are places that will do it for that. Go somewhere else. It's your cost. And guess what? It worked.
Yeah.
It worked well.
Everybody brings the price down and then they kind of compete. But it gets back to the idea when you have to mandate price transparency, something is really wrong.
Right, exactly.
Price transparency in every part of the economy except healthcare and probably higher ed and housing, maybe perhaps not so much housing, but certainly higher ed. Everybody pays a different price. And healthcare, again, it's third-party payers. There's so much murkiness. Nobody pays directly. No one's accountable for how much they spend and subsequently even how much they waste. I think that price transparency, again, is to fix a problem that exists because we have such a highly regulated health insurance market, which I guess brings us to the next thing, which is lowering insurance premiums. Now, this is a great idea, right? We're all in favor of lowering health insurance premiums. Now, Trump said when he announced his framework, the government is going to pay the money directly to you. Now, he's talking about the Obamacare subsidies. And he says it goes to you and then you take the money and buy your own health care. That makes complete sense, right? So what's going to happen? I don't know. Taking that pot of money and putting it into individual accounts makes a lot of sense. And people can shop out their own plans. The only problem is there is so much regulation on health plans. It's hard for these insurance companies to compete to get your business, right? They've got to meet all kinds of regulations about what they got to cover. And it's just very far from a free market. So recently, I think it was last week, there's an article in KFF that talked about new rules that came out from the Centers for Medicare and Medicaid Services in the Federal Register. And it says, Trump's team planned ACA rule offers its answer to rising premium costs, which is catastrophic coverage. Now, we love it's kind of what we call indemnity plan and insurance, what we used to have decades ago. Now, there is catastrophic coverage in the Obamacare plans. It's called bronze coverage. But there's so many restrictions as to who can get this plan. Like you got to be, because it's got a very high deductible. And I got to say, there's a ton of bias in this article, the way it's written, because they make catastrophic insurance sound like, it's unthinkable for people to have to pay anything for health care. And, if you have your own account and have to shop out for your own plan, like you do for auto insurance, for example, right? You're going to compare, you're going to watch that price every year. You're going to watch your driving habits, right? You don't want to get too many speed tickets. You don't want to make too many claims because your premiums are going to go up. We do not have that safety net in healthcare insurance. Anybody can do anything with their health and be covered for it. So we've got to get back to that system. True indemnity insurance has a set price. And, like you talk about, there's the Plan for America, which talks about privatizing all our entitlement programs, Medicare, Social Security, gives health insurance. But one of the things they have in this plan is indemnity insurance. And people who put their money into these accounts pay for one plan. It's like $11,000, $12,000, and it gives you $1 million of lifetime coverage. There's no mandated coverage. You just go if you have to make a healthcare claim, and you make the claim with the insurance company, and they pay for it. the bottom line, though, is you have a maximum coverage level of $1
Mhm.
million over a lifetime. So you're going to be really careful next time you want to go out and not shop the price for your MRI, right? You want to get the best because you want to use as little of that insurance as possible. And it's a really great concept. And I just, everyone right now, the media, we're so ill-informed about the healthcare system that anybody it presumes that any detraction from Obamacare, especially the media portrays this, is basically a ripoff, ripping Americans off. And that's not the case. Catastrophic coverage is probably vilified by all the special interests who benefit from the current system. They get their coverage of their particular item that people wouldn't necessarily buy in these health plans. So I think, the idea of being uninsured is a choice, right? People don't want to carry insurance because they don't need it. You can go get a direct primary care membership, pay about less than $1,000 a year to have unlimited primary care. And then maybe this is how I paid for my insurance over the last couple of years, get a short-term plan, and you have to renew it every 6 months. It's dirt cheap, a couple $100, and it kind of provides that catastrophic protection that most people want. They don't want a $500,000 bill on a heart procedure. They want to be protected in that rare event.
Well, yeah, absolutely. The key to lowering health insurance premiums is removing the mandates. Allow health insurance companies to sell the type of coverage Americans want. I'm willing to make a bet that I don't need $1 million drug every year, or a $2 million drug. I'd like to have a plan that maybe capped out at 500,000. I mean, heck, if you'd sell me one that capped out at 100,000, that would be good enough for about probably 95%, if not 97% of the population.
Mm-hmm.
So, Obamacare with its unlimited benefits was essentially a way to cross-subsidize extremely sick individuals that are very rare, and was a green light to drug makers. Oh, if you offer a $2 million drug, they got to pay for it.
Yeah.
Well, if you didn't have a mandate that there was no cap on benefits, either annual or lifetime, you wouldn't see $2 million drugs. You'd probably see the same drug for, 500,000 or 600,000.
Yeah. Well, look at Medicare and all the plans, the Medicare Advantage plans that throw in all kinds of goodies like eye coverage, dental coverage. These are things you can shop out fairly cheaply, right? But now what they do is they tell you, yeah, we'll give you free eyeglasses, but you got to go to our provider. So they make deals with companies that you wouldn't naturally select. I think most people would say, just lower my premium. Let me spend my own money and find my own eyeglasses. That's kind of how Obamacare runs with the networks. So I want to cover one more thing in the framework before we leave this topic, which are PBMs. And we did see some activity in the financial bill that was just passed, the appropriation bills. But I know, Devin, you've written quite a bit about PBM reform. It's kind of the bad guy that everybody goes after, even Republicans, not just the Democrats.
Oh, yeah.
Do you think PBM reforms get to the root of all the problems we've been mentioning?
Well, the trouble with having piecemeal reform is the biggest problem with PBMs is that we allowed the industry to consolidate, where the three biggest PBMs now controls 80% of the market. That was just crazy. I mean, I don't care what you do to reform PBMs, it's not going to help a lot until you force insurance, and insurance companies bought two of them. So, what's that tell you? It became a racket. So, and the root of the problem is, in no other industry do we have such large rebates. Like a drug maker, the rebate may be 40, 50, 60% of the cost of a drug. Well, if let's say you're a PBM and you're big and powerful and you're in basically a cartel, let's say, at that point, PBM stopped looking for the cheapest price to pass on to their client and started looking for the biggest rebate that
Yes.
they could dictate to their client. We get a cut, we get a big cut. And so drug makers, this is like 10 years ago or more, began to say, wait a minute, you're blaming us for high drug prices, but we're charging high prices, partly because we're being forced to pay huge rebates to middlemen who keep a lot of that for themselves. Mm-hmm. So, you need to get rid of the safe harbor that allows these huge rebates. And, it's weird to say, but consider breaking up some of these huge PBMs.
Yeah. The bill called for more transparency, which again is always a good goal. But again, our system is so dysfunctional that when you have to mandate price transparency, something is grossly wrong. And that, of course, is in drug pricing. And I don't think the average person even knows what the heck a PBM is, how they work, how they can make drug prices more expensive for you. Middlemen are all over healthcare, and they just all drive up the cost of price because everybody gets their cut. And then it's the consumer, the patient, the enrollee who ends up footing the bill. All right, let's move on to our next topic. This came out last week. Senator Rand Paul wants to end nationwide liability protections for vaccine makers. Now, vaccines have been in the news almost every week, with HHS Secretary Robert Kennedy making changes about the immunization schedule. We're hearing a lot of conversation about vaccine mandates, informed consent. All of these issues are not new. They've been talked about for decades, but now finally it seems like something is going to be done. One big problem that a lot of people point to is this law that came out in 1986, which gave a vaccine. It's called the 1986 National Childhood Vaccine Injury Act. And what it did was the idea behind it was good. They were trying to incentivize vaccine makers to develop vaccines without fearing lawsuits, because a lot of times vaccines, they're to respond to a public health crisis, and they want to make sure the drug is safe. And sometimes if it isn't, they want to be able to have that protection. But now, that was years ago. Today we have, but what a lot of people say it did was it provided a cover for these vaccine makers to put unsafe vaccines on the market. It also increased the number of vaccines in the vaccine schedule for children. And Kennedy has pointed that out. They say the simple answer to this is get rid of that liability protection and let vaccine makers figure it out. If they want to put a vaccine on the market, they're going to have to do the work to prove that it's safe and protect themselves from liability. This bill is being co-sponsored by Mike Lee. I don't know where it's going to go. There's going to be a lot of debate about it. It's very controversial. Do you have any thoughts on this?
Well, I get what you're saying about the incentives, but at the same time, I'm always very leery of opening up unlimited liability, in our litigious country. It's, there has to be a middle ground somewhere in there. But in the 70s and 80s, the number of vaccine makers was dwindling, and because they were getting sued. And the problem with vaccines is, vaccine makers are not entirely free of any liability. If it shows that they were negligent or did not produce, if they produce a vaccine in an unsafe environment out of compliance with the FDA regulations, they can still, and are grossly negligent, they can still get sued, as I understand it. But the problem is even a safe vaccine is not going to affect each individual the same. Out of millions of people, somebody is going to get sick, and they don't know who that would be or why necessarily, but there's going to be a handful of individuals, and some may get really sick. So the system is designed to compensate them um, without having to go to, a trial attorney and so
Yeah.
forth.
Now, the way this
And
works, yeah, go ahead.
it could even be, you could even have maybe I don't know, we kind of have that now, a vaccine court, but you could set parameters
Hmm.
where people have more rights to sue, but there's, maybe limits on how much they can get with a sympathetic jury.
Yeah.
That'd make, of course, fewer lawyers would take those cases, and they would have maybe less grandstanding as well. So, I mean, just totally repealing the law would kind of worry me. But, if they think there's a more efficient way to improve the law, I mean, hey, I'm always in favor of improving blunt instruments.
Yeah. So we have a database that gives consumers information about the safety of vaccines. It's called VAERS, and it's like millions and millions of claims on this database, and it's very hard to read. And they say it only covers, like, I don't know, 1% of vaccine injuries. And then what they do is every vaccine on the market, a percentage of that price goes to a pool that is used to compensate people for those injuries. And see, I'm not for lawsuits. I think that could be really destructive if we open the floodgates, given all the what we suspect the number of vaccine injuries. We just don't know. And these drug companies could really be paralyzed with unmitigated, uncontrolled lawsuits. But what we should do, see, the problem is we mandate vaccines. We don't give people informed consent. And then that changes the dynamics of all of it. So what we need to do is get rid of the mandates. And we do that on a nationwide basis. Right now, they're doing it state by state. I think it was Idaho last year was the first state to ban a mandate for vaccines. I think Florida is now doing it, and a handful, but it's being done on a state by state basis. To me, informed consent is everything. And vaccines, some people have very strong philosophical reasons for not using vaccines, not even just philosophical. Sometimes it's medical, sometimes it's religious. There are exemptions to vaccines, and some states really restrict those exemptions. And so I think probably we need to come up with a consensus on where we go with vaccines. It's a system for controlling disease. It's the idea is to prevent the disease from happening. But today we have treatments for disease. Like you don't have to prevent every disease that was a big problem 100 years ago when we didn't have those treatments. And we also have better sanitation, people in settings, we have public disease. Most diseases are becoming rare and can be treated. So it's not necessary that we have mandates. So I don't know. We'll see what happens with this bill. I don't think it's going to go anywhere.
Probably not.
Yeah. All right. Last item before we wrap up is crowdsourcing Medicaid fraud investigations. Now, on February 13th, Elon Musk came out with a website. This is from Doge. And last year, they took all the Medicaid claims and they put them in a database. Axios wrote an article on it and is very much against this and says this is just going to be awful. But I think it's very clever. Now, the database is very simple. You go in and you type in something. There's no patient data in the database. It's just claims. So, like, for example, if you're in Minnesota and you think there is a fraudulent Medicaid practice, you can maybe look up the address in this database and see all the activity that is being claimed in that address. And if you happen to notice it and say, my goodness, it looks like an abandoned office place. I mean, that would be a good way of controlling crowdsourcing Medicaid fraud investigation. In fact, that's kind of how we got to the bottom of what was been going on in Minnesota. We had a guy who went out with his camera, Nick Shirley, and went to all the addresses that he could find in state, FOIA documents and find that these were fraudulent setups. right? I think it's a great idea. I don't know who's going to do it. If you're really incentivized and want to make some money. Oh, the other thing is the Department of Treasury has announced a prize. So Treasury is setting up a similar website for Medicare fraud, offering 30% of what is recovered. So if you've got a fraudulent Medicare provider in that base and they go after it and they find it is fraudulent, you can recover 30% of whatever they recover. They say something like there is $1 trillion in healthcare fraud. I believe that. And I think, with the technology that's available and people who are so clever who can go out and kind of be their own one-man band investigators, I think we might get to the bottom of a lot of this.
That's a great idea. I mean, it was a few years ago, various entities, I think the Wall Street Journal was part of a lawsuit, that finally got access to some of the claims data for Medicare. What is being paid to providers, and the doctors fought it tooth and nail. But I mean, it should be public data. How much are we giving, certain people for care? If it's in the millions, to say tens of millions to one physician, we know something is probably wrong. Well, in this case, if it's, it would allow us to scrutinize, like you said, is that really a practice? Are there patients lined up? And if they are they really sick? Because there's a lot of fraud in Medicaid, and there's a lot of fraud in Medicare, and especially among the durable medical equipment dealers for some reason. Yeah. And in Florida is pretty bad in Florida. So yeah, anything we can do to shed some light on these huge claims and create a system for people to scrutinize the claims. Because I mean, private insurance companies tend to do this automatically through software. CMS does not really do it as well. I mean, they do maybe a tiny bit, but they really need to get busy, invest in the software, create the software, or even pay companies to do it, and use this data to find out. And it has a treasure trove of information about the type of fraud being created. I mean, it's just ridiculous that we put up with all this.
Like, for example, where that last shooting was in Minnesota, it was in front of an address that was very suspicious. Many, many claims in that building, lots of business, a lot of money that was going through that address. And, I'll tell you, if the media has the same fervor in investigating Medicaid and Medicare fraud as they do the Epstein documents, we'll be in great shape. Yeah, I think it's a great idea. And then, with artificial intelligence, I think we can really get to the bottom of a lot of this stuff. And what you want to do is keep people on edge. If they know that they're going to get caught, they will probably steer away or find a legitimate way to make money. Mm-hmm. But right now, it's pretty easy to make money through fraud. So that's got to end. All right. Well, we have run out of time. Be sure to check out healthcare news at heartland.org, the website there, and the Goodman Institute Healthcare blog for free market perspectives on the very latest in healthcare news. And you can find links of all the articles that we discuss in our podcast notes. So lots is happening. We'll be back very soon. Check with us again in a few weeks. In the meantime, stay well, stay safe, and thank you for tuning in.